Hi, I'm Mark Bashore. Welcome to another in our Trusted Voices series. This is a production of Relaunch Greater Lansing. Our aim here is to share accurate, timely, important, fact-based information regarding the pandemic and more specifically COVID vaccines in the hopes of getting as many people vaccinated here in the very near future. With us today, Michigan State University President Dr. Samuel L. Stanley. Dr. Stanley, many thanks for joining us today.
My pleasure, Mark. It's great to be with you.
You have a unique perspective on the pandemic and on the vaccines, given your unique background. Not only are you obviously the president of MSU, but you're also a medical doctor who has studied infectious diseases. You're a family man with kids. How has your particular background affected your approach to COVID and to the vaccines?
So when I was a professor at Washington University School of Medicine in St. Louis, I was director of the Midwest Regional Center of Excellence for Biodefense and Emerging Infectious Disease Research, a very large grant funded by the NIH to help prepare the United States essentially for bioterrorism or emerging infectious diseases. I've also served on panels such as the National Science Advisory Board for Biosecurity, which I chaired for 5 years, the NIH Blue Ribbon Panel on the National Emerging Infectious Disease Laboratories, and on the NIH National Advisory Allergy and Infectious Disease Council. So I was very familiar with the early viral outbreaks of coronaviruses, including both SARS and MERS, and how they were contained by public health measures. And I monitored the novel coronavirus, SARS-CoV-2, as we call it now, as it emerged last year. And very early on, I think, began contingency planning when I realized that this was different than SARS or MERS. It wasn't going to be contained by standard public health measures, and it really did pose a pandemic threat, essentially, to the university. So we continued to monitor cases on campus in the community. We developed a number of safety measures at Michigan State University, including, of course, strict mask wearing, physical distancing, and other requirements in our community compact. And now, of course, we're incredibly excited about the vaccine, because this really does transform our ability to deal with this disease.
Talk to us about the particular concerns that you've heard from faculty and staff and students about the vaccines, and just as importantly, how have you responded to these concerns?
So the biggest concern obviously has been about access. And we've done some polling and 80% of our students want to get vaccinated. We know a very high proportion of our faculty and staff at Michigan State University want to be vaccinated. So the real question has been about access. As you know, that's changing, and today is an important day for that in terms of increased eligibility now in the state of Michigan. That's going to make a difference, but it's still important for us to be able to get vaccine. So we've done our best to help with this. We've set up a major facility at our pavilion to allow people to get vaccinated. We're working with Ingham County Department of Public Health to do that. We can vaccinate thousands of individuals every day, but we're willing to gear up, and we're hoping that at some point in time, as vaccine supplies loosen up, that the state will provide vaccine either directly to us or in conjunction with another provider, and allow us to really vaccinate faculty and students on campus. We would love to be able to vaccinate our students before they go home for the summer. We think that would be good for the state of Michigan overall if we were able to do that. And so that way we wouldn't have to worry so much about a spike during the fall return. The vaccine is so incredibly important, as I said, and we're doing everything we can to make sure our faculty, students, and staff, and the community around us has access to it.
As we speak here in early April, how likely do you think it is that you'll be able to do that, to vaccinate students before they go home?
So again, we've been in discussion with the public health department to see what availability will be. And I think it just depends on how many doses Michigan is going to get. And if Michigan gets enough doses that we would have access, we would be able to do it. If not, we'll arrange and work with students to make sure they get vaccinated anywhere they can going forward.
Are you requiring vaccines for faculty, staff, and students?
So it would be difficult to require for employees for a number of reasons. And I think our employees are very motivated. I know our faculty and staff have been very excited about the vaccine, so I'm not worried about that. And as I mentioned earlier, about 80% of students plan to get the vaccine. So I see our challenge as more making sure they have access and helping them achieve that goal than actually mandating or requiring as being necessary. However, we'll follow uptake of the vaccine among our faculty, students, and staff, and we'll make sure that people are accepting vaccine, because we really do want to reach a level of 70-75% vaccination in our population to really help us open more safely in the fall. Everyone wants to return to normalcy. And that includes everybody at Michigan State University. But to do that, we have to get people vaccinated. It's incredibly important. So I think there were strong incentives for people to do it. It changes how we're going to run our campus in the fall semester if we have people vaccinated. So again, I think we're not looking at mandating right now, but we'll see what happens in terms of uptake of the vaccine. But I think people, as I said before, are really strongly incented to getting vaccinated.
What do you view as the biggest hurdle right now in terms of getting as many people vaccinated as possible?
So Mark, as I said earlier, I think supplies and distribution still are a big factor. And again, we're ready to help with that. But then also, I think there's some hesitancy in the parts of certain populations. And so there's misinformation that's being shared. This is one of the times when social media is not always helpful because people don't always know how to discriminate between what's fact and what's misinformation. That creates challenges for us. As an infectious disease doctor and someone who actually did work on vaccines, I can tell you I was remarkably, almost astonished by how effective these vaccines are and how little they have in the way of adverse events. This is better than I expected in terms of their efficacy. This 90-95% efficacy against disease is outstanding. And again, I think we're now seeing the vaccine also helps prevent infection and transmission as well. So this is much better than I expected. I thought we might be something closer to a flu vaccine, which is more like 50 or 60% effective. So this is wonderful. It means people should be getting it. And I think a lot of people just need to be educated more about this. And I think particularly I'm concerned about some of our underserved communities and populations. We have 2 people from Michigan State University on the governor's task force on racial disparities, Deborah Verholden and Randy Raj, the dean of our college, MSU College of Nursing. And they're helping to advise the governor on ways to get the vaccine and help educate people and everyone about the necessity to take it.
For anyone who remains hesitant about getting the vaccine, what particular nugget of information do you think is most constructive in persuading them to get it?
Well, I think get informed, obviously, and that means going to sites that you should be able to respect. And now we talk about the CDC site, for example, or the WHO site. These are sites that really are devoted to health. Speak to your primary care physician. We find that one of the things that people care and trust the most, people care and trust the most, are their primary care physician. One of the most trusted physicians of anybody in the United States. So talk to your physician. They have your health in mind. And I think you're going to find they will strongly endorse you receiving the vaccine. If you don't have a primary care physician right now, you should get one. But in the meantime, find a trusted and credible source. Talk to your friends and family who've been vaccinated about their experiences with the vaccine. Again, we find adverse events are really rare and the efficacy is very high. Ultimately, you're making a choice, the virus or the vaccine. For many people, the virus remains potentially a deadly threat. And the vaccine has been proven safe and effective in literally millions of people. Millions of people now have had this vaccine. And it was built on work that was done decades ago when SARS and MERS, and that's when vaccine work first started. So it's not work that's only been going on a couple of years, it's work that's been going on for decades. And they're very, very effective. So take advantage of this wonderful vaccine.
One final question. How concerned are you about future variants?
So I'm very fortunate right now in that the major variant in Michigan, B117, is prevented by the vaccine. It seems to be fully effective in preventing that viral infection by that particular strain of the COVID virus. Other variants also, the Pfizer Moderna vaccines appear to be effective. There's been some data about the Johnson & Johnson vaccine in the South African variant that's a little concerning, but so far, again, it seems to be protective in those populations as well, maybe slightly reduced efficacy there. We don't have a lot of the South African variant, fortunately, in the United States, so that's less of a concern. We're in a bit of a race right now, Mark, a little race between getting people vaccinated and controlling outbreaks, which will in turn help control the expression of variants. There's more likely to have variants arise when there's more virus in the population. These viruses mutate very frequently. The more viruses out there, the more new mutations they generate, and occasionally they'll generate one that makes them more effective in transmission or more lethal. And so we want to avoid those new variants, and the way we do that is by vaccinating people, stopping transmission, and eventually, hopefully, stopping this disease or at least reducing it to a bare minimum.
Well, we want to thank you, Dr. Samuel L. Stanley, president of Michigan State University, our latest installment here in our Trusted Voices series. A very challenging time. We appreciate your insights and your leadership. Many thanks.
Thank you so much, Mark. Appreciate it.